Well, hello again, everybody. Today is the 31st of August. Welcome into another Keep Boone Healthy Community Information Channel update. I'm David Jackson with the Boone Area Chamber of Commerce, joined by Jennifer Greene, Director of Public Health and CEO of AppHealthCare, Sean Burroughs, Director of Pharmacy for Appalachian Regional Healthcare System. We come to you today to give somewhat of a COVID update here for the community, but talk about a couple of things that are a little bit topical here within our community and every other community. And that is partly access to booster shots and also what conditions are like in our healthcare system. We've heard a lot of discussion around the state about what hospital capacity is like, what treatment options are like. So again, as we have done with this particular channel, we want to paint what that picture looks like here locally for you, so that can help inform your health decisions or help you advocate for those that may still have some decisions to make in your lives. So Jen, let's start with you first, like we often do. Can you give us a little bit of a situation report, if you will, on where COVID metrics are, not only here in Watauga County, but throughout the high country?
David, I would love to give you great news, but the reality is we have been here before. And unfortunately, what we're seeing right now in August, the last day of August, is what we saw in the wintertime peaks. We're experiencing lots of transmission across our region. And I think, it's really important folks know that we've got 143 active cases as of today, and those are the cases that we know about here. We always estimate that being an underestimate, really, the total number of COVID individuals in our community. And sadly, we've got a lot of people sick. So I think it's time for people to be vigilant. Remember the 3 W's. I know we're tired of talking about it, but it's important that we remember that right now.
And we feel like, and if it does feel a little bit like Groundhog Day, it's because we have been messaging a lot of those same things. What is it that you are seeing, I guess, in your trained public healthcare eye that is bringing us back to this point again? Because I think some people see, hey, there for a while, numbers were low, things were better off. Certainly then the Delta variant comes into that. But is it just the variant, or is it that people have kind of let their guard down maybe after a summer of not having to maybe worry about masking as much, and then having to be thrust back into the reality of a whole bunch of stuff that we thought maybe had gone by the wayside, or at least had worked its way behind us in its level of prevalence that it once was?
Yeah, I think it's a little bit of both. Obviously, the Delta variant is more contagious. We know that. There's a lot of information that we have now that tells us it's more contagious and can infect more people. And unfortunately, that's what's happening. And you combine that with people who may be tired of wearing a mask, me too, but we need to be doing it because it is one of the best tools we have besides being vaccinated. And that's the first and most foremost important thing that we can do, is talk to everyone in our circle about getting a vaccine.
We'll talk a little bit about booster shot availability here in just a moment, but Sean, wanted to kind of throw it over to you a bit. There has been some content coming out of Appalachian Regional Healthcare System here of late, a video that I know has made it around the community here about what conditions are like inside the hospital, and what the medical staff inside our regional healthcare facility is dealing with on a daily basis. What can you tell us about not only that snapshot, but what you're seeing in terms of cases and number of folks admitted and the trends there?
Yeah, thanks, David. I would say, first, I would implore everybody to educate yourself. Watch the videos, read the literature that's out there. There's been a lot of information coming out quickly over the last couple of weeks because this has happened so fast. But there's some really good stories out there, and people really need to see what's going on, inside the walls of the hospital. At this morning's report, we have 18 people in the hospital with COVID. We have 4, yesterday was 5, 4 of them are on ventilator today. And the numbers don't lie. Of the 18 people in the hospital, 1 of them has been fully vaccinated, and 17 have not been fully vaccinated. So, our community is at 50-some% as far as a vaccination rate, but in the hospital, that's not the way it looks. The unvaccinated folks are the ones that are in our hospital on the ventilators, critically ill, and the ones that are not making it out. So it's sad in here, to be honest with you. So it's just tough. It's tough being in here. It's tough on the staff that have been through this once and are having to go through it again. It's a difficult time.
One of the things that may not be as top of mind, because we've heard the 3 Ws and we've heard the masking and we've heard all of those kinds of conversations, but we haven't spent a lot of time talking about what happens if you are hospitalized. So what can you tell us about treatment options that are available here in the high country and our standard practice for those that may come to the point where they do have to seek medical care?
They're not good. They're just plain not good. We have, if you come in with a pneumonia or bacterial infection, there's a number of different antibiotics that we can use to help get you over the hump for your pneumonia, for your skin infection, or whatever it is that you're in, whatever bacterial infection you're in for. We can take care of you. We can get you out. We can make you feel better. Even with flu, there's medications such as Tamiflu that can help you decrease the duration of your symptoms. That's not a great treatment, but it can help. With COVID, we don't have anything. But, we've got some steroids that we can give you that seem to have good results. Maybe some blood thinners so that you don't form a clot. But as far as treating COVID itself, we'll give you some things that are available, but the data behind them are just not very good. That there's no mortality data that shows that what we have in our arsenal is going to actually help you not die. And I know that sounds harsh, but that's the truth. When you're in the hospital, when you're in ICU, we can support you, and hopefully we can help you support you enough so that you can turn around and come out of our hospital. But we don't have hardly anything that we can actually treat this virus with, unfortunately.
Jenna, I believe since we talked to you last, we have seen full FDA approval of the Pfizer vaccine. We have heard more conversation about booster shots. Certainly a lot of people that have children who are under the age of 12 are wondering what that timeline is looking like. Can you give us any updates on where the booster process lies, and also any news that you've got on other age groups that may become eligible for vaccine soon?
Well, we're just like the rest of the community, we're still waiting anxiously for the younger kids to be able to be vaccinated as soon as possible. So just want to say, parents, thanks for hanging in there with us and staying informed. I know our healthcare community is really working hard to be on the forefront of that. There's a lot of plans in place. In terms of boosters, we know September 20th is the date that we expect to be able to have more boosters available for the broader population. We're still waiting on some additional information and really some clarification. Right now, what we expect is that it's going to be for anyone who's had their vaccine 8 months prior, and specifically the vaccine Moderna or Pfizer. We're still waiting on information about boosters for Johnson & Johnson, although everything I'm hearing is that that is likely to come too. And it sounds hard to hurry up and wait, but I think that's where we are right now, which is why these other prevention measures, like telling your family and friends about information that's available so they can educate themselves on a vaccine, and also wearing a mask when you're indoors in public is so important.
One of the I guess kind of functional elements of back in February, March, April, when we were seeing people go from first shot to second shot, there was communication there that went with whatever that provider was that gave you that shot. So if I got my shot from AppHealthCare, I got an email saying, all right, you're eligible for your second shot. Here's where you schedule that. Here's where you go, and all that kind of thing. For people that are trying to plan what that looks like, do you anticipate it being that kind of contact again, that people that are eligible for a booster will get that correspondence, or will it really be more on the people to understand what their shot regimen was like, when those dates were, and then begin to figure out where they might be able to go to a number of different providers now in our community to get that booster?
I think we're going to be working together so we have clear messaging for the public, all of the vaccine providers. But I also think, the good news is that there's a lot more availability of the vaccine than there was when we first started. And that is something that we're grateful for. We know we have lots of pharmacies, including our partners at Boone Drug, that have a vaccine available, High Country Community Health, and other supermarket pharmacies. So there's going to be more options for folks. And I think just having your vaccine card knowing when you were vaccinated is going to be important. We'll be putting out more information, but I think really it's going to be probably watch for the information, and we'll probably do a little bit of both, some proactive outreach, but also just having more options for people so that they can seek what they feel comfortable, getting.
Have you seen much of a change in vaccination rate overall in the community in the last few weeks?
We've seen more people come in for vaccines at our office, and certainly that's encouraging. I do think we have a long way to go to try to be where we really need to be, which is much higher percentage, so that we can slow down this transmission rate of COVID. But I'm happy to see that we've had more people come in the last couple of weeks to get vaccinated.
Sean, is that the kind of a similar way that you're seeing that across the hospital system providers? I know not only here in Watauga, but in Avery and some of the other outposts that you have.
Yeah, for us, it's been a slow trickle of folks that have decided with the new variant, that have seen what's going on, that have come in. We need more. I know there's going to be a lot of discussion over the next few weeks, as Jen just alluded to, about booster doses for third doses for folks. And I think the high risk population, the elderly folks, the ones that have a lot of other disease states that put them at higher risk for bad outcomes if they get the virus, I think it's important to try to get that third dose or booster dose for those folks. The most important thing from our end is that for people that have not been vaccinated, even though we're going to be talking about a booster and a third dose, we need the people that haven't been vaccinated to get vaccinated, because that's who's coming in our hospital, and that's who's not leaving our hospital. So I really want to make sure that that message is out there as well, along with the boosters, that gosh, if you haven't yet been vaccinated, like I said, educate yourself, see what's going on right now. And treatment's not there. The best treatment is prevention, as Jen said before, and vaccine is our best tool. Now, the data on the vaccine versus the Delta variant isn't as good as it was with the original strain. But the data on still preventing hospitalizations and deaths, even though you might still get coronavirus if you've been vaccinated, we're not seeing those deaths with patients that have been vaccinated. So if you have to deal with a little bit of illness to prevent you from dying or coming in the hospital, there's no question that that's still worth it.
I think it's certainly been a heavy time. I know we were all just talking about that a little bit ago, and people are kind of going back into this again and really kind of dreading where we are, because we've been here before, and the unfortunate thing is here we are back here again. But at this time, it's also important to keep in mind and keep in your thoughts those that are trying to make things better for folks. Certainly our healthcare providers, our folks that are working frontline jobs and whatever business application that may be, everything from restaurant workers to childcare workers to those that are keeping the schools open and all of that type of thing. They're doing really hard work right now because people are frustrated. They don't want to be told that they have to do all this stuff, yet here we are. And a lot of these frontline workers are dealing with the brunt of that, even though the decisions that are being made are not their decisions to make, but they are the ones left to enforce that. With all of that said, Sean, I know that the hospital's got an event planned for later this week to pay some respect to those frontline healthcare workers that have been there since day one and haven't gotten a break yet, really. To show that once again, this community is a caring one, that we all know that it is. Can you give a few details on that and how people can participate?
I think more information will be shared on our website, and I believe it's going to be sent out along with this video for people to come and just be a part of the healing for the healthcare personnel and for the community that has had to deal with this. And it's here we go again, and people are going to need to step up and just you go through it again, and it's hard. It's you can just see it in everybody's faces. You can feel it, and it's hard to see. So anything that anybody can do to help uplift some of the frontline healthcare workers, whether it's in the hospital or whether it's a health department or wherever, I think it's important for the community to be a part of that and help out.
Jen, and I would imagine keeping tabs on mental health resources too in the community. it's an overwhelming time, but there are people that can help. I know AppHealthCare has been a great resource for that, as has the hospital system. How are you helping refer those folks right now that may need somebody to talk to try to take some of the weight off a very heavy situation?
We are providing telehealth, and we do have in-person behavioral health services available, but we also have the Hope for Healers line, and offer all kinds of different referrals for folks based on what they need. I think we all are tired, and I would echo, the support for the public health staff and the healthcare workers is so critical right now. There are so many things that we are trying to do to keep people safe, and people don't, not everyone is happy about it. So I think, whatever folks can do to try to support in whatever way makes sense, is really helpful. We're working really hard to make our resources available for folks, and you can find that on our website, David.
And we've got links to our relaunch and recovery page listed along with this video. As Sean mentioned, we've got information on the vigil. We've got information. That's what you come to this thing for. So we're going to give it to you. Last question I've got for you, Jen. We have certainly talked to a lot of businesses here over the course of the last few weeks that are really kind of struggling with that whole mode of operation. They're bringing in new staff. Some of those people are new to the community. When you're talking about some of our newer college students who haven't been here for the last couple of years, whether they're freshmen or sophomores, this is their first Boone experience. So what's your advice to those that are struggling to keep up with the operational elements of this? We know that there is no government programs, no PPP loans, no nothing like that coming behind to help people out in that regard. So they are really trying to work that balance of inform their staff of what's safe, do the right thing from a responsibility standpoint, yet keep a business afloat that could be employing dozens or even more people in the community, which obviously, if it goes the other way, leads to a whole different set of circumstances from a public health perspective we don't want to talk about. So what's your advice to those that are trying to make it work right now?
I think you have two tools that you have to rely on. One is, initially, it's your influence and your ability to encourage people to do the things that will help us slow the spread of this virus. And the first one of those is obviously to get vaccinated. So encouraging by modeling, encouraging in whatever way you can to try to get more people, whether it's customers or employees, to be vaccinated. It helps people be at work. It limits the amount, of time that you're in quarantine, or, because most of the time, if you're not having symptoms and you've been exposed and you're vaccinated, we do encourage you to be tested. But, the vaccines are working really well. So I think encouraging folks to use their influence to encourage people to be vaccinated is important. The other tool is using masks when you can, indoors. Masks are the other key because this is a respiratory virus. So I think don't underestimate your influence because you do have more influence than you realize. And I think otherwise, reach out to us. We're thinking of new tools all the time to try to help make it easier for folks to navigate how to keep a workplace safe. And finally, David, I would say just remind folks, stay home if you're sick because you could impact other workers at work or customers that you're serving. So those are good reminders for us.
Yeah, it's a minor inconvenience that avoids a major setback. If you can just that last thing that you said, I think that's the one that I've continued to hear more is, this is not the time to power through. This is the time to err on the side of caution. Laying out a few days to make sure that you're not COVID positive is a whole lot better than, again, like you mentioned, infecting an entire staff and shutting down a business, shutting down a healthcare facility, or shutting down a school, whatever it happens to be. We've got to be smart as a community out there, and that's certainly a great way to do it. I appreciate you guys. Oh, go ahead, Sean. Sorry.
I wanted to close with, obviously both Jen and I feel strongly about vaccine and the effectiveness that it is at not only preventing the virus, but also preventing hospitalizations and deaths. We're also realistic that not everybody's going to get vaccinated. So I would just encourage those folks that choose not to get vaccinated to be smart. Really, you're going to have to be extra careful to wear your mask, to I don't want to say isolate, but it just, social distance as much as you can, because as I mentioned, that's who I'm seeing in here that are critically ill are the unvaccinated folks. So even if you choose not to get vaccinated, just please be smart about what you do and who you do it with.
Very well said. Thank you both for your continued leadership and your willingness to discuss these things. And we'll continue to connect, I'm sure, on a regular basis as we have, and continue to get information out to folks. So thank you for your time today, and best to you both.
Thanks,
Thanks,
David.
David.